Welcome to today's Explainer. Today, we are going to unpack how the human body masterfully engineered an incredibly complex biological system. We're looking at a fascinating evolutionary journey where our anatomy made a massive compromise, trading structural stability for unparalleled, world-altering mobility. We are talking, of course, about the shoulder joint. Let's jump right into the core paradox here, straight from our source material that truly defines the shoulder. As we transitioned from the weight-bearing forelimbs of quadrupeds to the freely mobile upper limbs of humans, a huge structural shift occurred. We gained the amazing ability to place our hands almost anywhere in three-dimensional space. But, as the text notes, this comes at a severe structural cost. We completely sacrifice stability, and that single compromise is responsible for nearly all the pathological changes and injuries this joint experiences. Here's our roadmap for today. We'll start with mobility at a cost, then look at the bones of the shoulder, joints and linkages, the rotator cuff, mechanics of movement, and finally wrap up with when things go wrong. Let's get right into it. Section 1. Mobility at a cost. The great evolutionary trade-off. Think about the ultimate physical trade-off. Our shoulder is, without a doubt, the most movable joint we have. Its main function is to enable us to place our hand exactly where we want it in a highly coordinated and controlled manner. But consequently, because it's so incredibly mobile, it is inherently the least stable. In fact, it's the most commonly dislocated joint in the entire human body. You simply cannot have maximum freedom of movement and maximum structural security at the same exact time. Moving right along to Section 2, Bones of the Shoulder, the fundamental hardware. Picture the primary articulation of the shoulder girdle, the glenohumeral joint. You have this large round head of the humerus, the arm bone, just sitting against an incredibly shallow socket called the glenoid cavity. Even though there's a little ring of cartilage called the glenoid labrum that slightly deepens it, structurally it functions a whole lot like a giant golf ball trying to balance on a very small tee. There's hardly any bony enclosure actually holding it in place. And if that doesn't sound precarious enough to you, try this. Reach up and physically touch your collarbone right near the center of your neck. Do you feel that? You're feeling the sternoclavicular joint. That is literally the one and only tiny joint that anchors your entire arm and shoulder to the main skeleton of your body. Everything else is miraculously suspended by just muscles and ligaments. Section 3. Joints and linkages, connecting the biological engine. So, the shoulder isn't actually just one joint. It's a whole complex of 4 distinct articulations. We have the glenohumeral joint we just talked about, the acromioclavicular joint out by the point of the shoulder, the sternoclavicular joint at the chest, and finally, the scapulothoracic linkage. And honestly, that last one is basically just your shoulder blade smoothly gliding right over your ribs, hoping for the best. Normal function requires smooth coordination across all 4 of these linkages. If you get an impairment in just a single one of them, it leads to a functional defect of the entire complex. Section 4. The rotator cuff, the stabilizing engine. Now, if our bone structure is inherently unstable and the socket is so incredibly shallow, what keeps our arm from just falling right out of its socket when we're, say, carrying heavy groceries? Well, the answer is the rotator cuff. This is a fused group of 4 specific muscle tendons, the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. These tendons physically fuse with the underlying capsule of the joint itself, acting as the dynamic, active stabilizers of the entire shoulder. And here's the really crucial point. Their primary job isn't actually just generating rotational movement. Their true genius is that they actively grasp that relatively large head of the arm bone and continuously pull it medially, hugging it securely against that small, shallow socket. They provide the dynamic tension that keeps that golf ball pressed firmly onto the tee. Section 5. Mechanics of movement, putting it all into motion. This brings us to a beautiful mechanical concept called scapulohumeral rhythm. When you lift your arm, you probably think only your arm bone is moving, right? But in reality, most movements at the shoulder involve the humerus and the scapula, your shoulder blade, moving simultaneously, not successively. They are perfectly choreographed to work together to expand your reach. To be exact, they move in a 2-to-1 ratio during abduction, which is when you lift your arm out to the side. So for every 15 degrees you elevate your arm, the humerus moves 10 degrees and the scapula actively rotates 5 degrees. This shared workload is exactly what prevents the arm bone from just jamming right into the top of your shoulder during extreme movements. And this brilliant coordination results in some sheer mechanical output. By combining the movement of these joints, we are granted a massive range of motion. We're talking 180 degrees of abduction straight up over our heads and 90 degrees of forward flexion. It truly is an absolute three-dimensional marvel of biomechanics. But, with so many moving parts relying on such precise coordination, and with stability deliberately sacrificed for that massive range of motion, we have to ask, what happens when this complex engine inevitably breaks down? Which brings us to our final section, Section 6, when things go wrong, clinical realities and wear and tear.
Let's start with the bone that anchors it all. The clavicle is actually the most commonly fractured bone in the human body. Why? Because when we fall, we instinctively put out an outstretched hand to catch ourselves. That indirect physical force travels right up the arm and blows out the collarbone, usually right at its middle curve. When it breaks, the sheer weight of the heavy arm pulls the outer fragment down, while your neck muscles pull the inner fragment up. It's why the classic clinical picture is someone supporting their sagging arm with their opposite hand.
Then, of course, there is dislocation, which is notoriously common. When the shoulder dislocates, the head of the humerus mostly drops inferiorly, meaning downward, because the joint capsule is least supported on the bottom. This creates a visible hollow contour where your round shoulder used to be. What's really critical here is that this drop can easily damage the nearby axillary nerve, and that can lead to a literal loss of sensation over the deltoid muscle, right on the outside of your shoulder.
And we can't ignore everyday wear and tear. Over the years, repetitive overhead motions, things like swimming, throwing, or painting, can trigger a debilitating cascade of structural issues in the rotator cuff. It often starts with calcium depositing in the overworked supraspinatus tendon. This calcium irritates a little fluid-filled sac called a bursa that sits just above it, causing subacromial bursitis. Eventually, when you lift your arm, that swollen bursa gets painfully pinched between the tendon and the overlying bone. This specific impingement creates what clinicians call a painful arc. Lifting your arm specifically between 60 and 120 degrees of abduction causes intense, localized pain. Interestingly, and this is kind of a neat clinical trick known as Dodd-Barnes sign, if a doctor presses on your shoulder while your arm is down, it hurts. But if you lift your arm up, that swollen bursa slips completely hidden under the bone, and the pain upon pressing completely magically disappears. Another incredibly frustrating failure is a frozen shoulder or adhesive capsulitis. Mostly seen in adults between 40 and 60, this is a truly bizarre condition where the joint capsule literally shrinks and adheres to itself. It painfully restricts all uniform movement of the joint, making it feel completely locked in place, even though X-rays will show the bones themselves are 100% perfectly healthy. It just goes to show how utterly reliant this joint is on its fragile, soft tissues. Our shoulder truly is an absolute marvel of biological engineering. It is an engine that traded the safety of stability for the immense world-altering power of mobility. It makes us wonder just how much we take this fragile, perfectly choreographed mechanical balancing act for granted every single time we casually reach up for a high shelf. Thanks for joining me on today's Explainer, and I hope this completely changes how you view your own amazing anatomy.